They're two happy women bringing you inspiring stories, politics, pop culture, and lifestyle hacks, all with an eye to making our communities and our country a better place to live. It's the Happy Women Podcast with your hosts, Jen Horn and Katie Gorka.
The clock, we are all trying to live better, live longer, and, well, live healthier. And that is the topic today on the Happy Women Podcast. Welcome in. I'm Jennifer Horn. Katie Gorka, she's out today. She's on special assignment, saving the world, I think somewhere in North Carolina. But super excited to welcome into the program Dr. Doug Lucas. His last name might sound familiar to you. His wife, Ashley Lucas, was just on the program, on the podcast a couple of weeks back. And I think we're a big fan of your whole family, Dr. Doug. Thanks so much for being with us today.
Yeah, super happy to be here. These are topics that I talk about a lot because I'm very passionate about educating people on what they can and maybe shouldn't do.
I love that. We need a list of to-dos and not to-dos. And it's really interesting. And by the way, people can find you, drdouglucas.com. He also has a podcast, The Dr. Doug Show, so you want to check that out. But I do think the more we learn about our body, our health, the smarter we become, the healthier we become. But we also get a little confused along the way because there are so many people with so many different takes on information. It's hard to kind of cut through the noise. And so I'm excited about this today. And I really got to start with HRT. Hormone replacement therapy is something I think a lot of people believe is just for women, but it can also be for men as well. So for those people who aren't familiar with HRT, what is it? Who is it for?
Yes, so it is for all humans. So, humans, both male and female, have sex hormones and they decline in both sexes as we age. Just for women, as they go through menopause, it declines faster. But it's a problem for both men and women, and it's becoming a bigger issue because we have more dysfunction earlier in adult life. So this is becoming a bigger and bigger topic. It's now it's not just post-menopause hormone replacement and testosterone for older guys. Now it really is the full spectrum of adult life.
Is it just me, or does it seem like, I mean, you have to tell me, you're the expert here, but I know our bodies naturally change as we get older, but I also feel like there's a lot of environmental factors that go on, things that we find in our diet. What actually causes us, aside from the obvious, the aging process, what causes our hormones to get out of whack? What causes an imbalance?
There are a lot of things now. And it used to be, I think, if you go back a few generations, it really was mostly just aging, the effect of, time and disease building up from other areas. But now in our, current environment of high chronic stress, poor sleep, environmental toxins, PFAS,
I think you're describing my Wednesday.
it's all of us. It's all of us.
Mm-hmm.
And so what's really scary is we see in both women and men hormone dysfunction early in life. And we know that this is a problem because hormones are tied to every other organ system. And so, yes, we still, have to work with people that are older and optimizing hormones where applicable. But now it really is a conversation about how to optimize hormones in young adults.
So let's start, I guess, since it's a Happy Women podcast, we should start with the women, but let's start with the men, because I actually have a friend who is a big fan of supplementing. He does testosterone, and he says it helps him keep his body fat low, helps him keep his muscle mass high. He believes it's the secret to aging. His health reports show that as well. He seems to have the body of a 39-year-old when he's 55 years old. So for men, who should be using HRT? Who should be maybe supplementing with testosterone? And what benefits and risks are there?
Boy, how much time do you have?
We got a half hour. Let's go.
Yeah, I don't want to ignore the women, though. So
no, we're coming.
Men, TRT is controversial, but it really shouldn't be, because testosterone replacement has clear benefit for, if you were to look at a list of the symptoms of aging for men, there's actually a study that shows this. But if you look at the list of all the symptoms of aging for men, about 80% of them can be improved with testosterone. There is not a single drug, approach, lifestyle, anything that can improve that many things. So it is a very powerful tool. But who should be on it? This is a really dicey question because the FDA has only approved testosterone replacement for men that meet certain criteria. And those criteria are really strict. So according to the conventional medical system, you have to be in pretty bad starting position to start using testosterone replacement. Now that said, in the longevity space and in the health span, anti-aging space, it's used off-label very frequently for men that don't have as low of testosterone. But where you find that balance, that's in the art of medicine. Who's going to benefit, who's not. From a risk perspective, most men are going to think about, if you Google it, you're going to hear about the risk of heart attack, the risk of prostate cancer, and blood clot. Those are kind of like the three big risks. But if you look at up-to-date literature, there was just a study that came out, the Traverse study in 2023, that showed that there was no increased risk of heart attack. There's never been a study showing there's an increased risk of blood clot. That's all extrapolated from another problem. And then prostate cancer, actually low testosterone is more strongly associated with prostate cancer than is testosterone replacement. So like all of these major risks have really been kind of misconstrued, misunderstood in the literature. And I think we're in a new era of testosterone replacement, but a lot of the dogma hasn't caught up.
All right. So on to the women, because this is where I think we'll probably really jump into it, because this is not as controversial for women, although there is still a school of thought, as you mentioned, with the risks that if you choose the route of HRT as you're going through menopause or perimenopause, that this can up your risk of cancers. You have to be careful. There are all kinds of HRT. I'm interested to know your thoughts in sort of what is better than others, in your opinion. But my question to you as someone in my mid 40s is perimenopause is rough. I mean, I thought people were kidding. I mean, it can be rough. You get the brain fog, kind of the energy lapses. I've been on this health journey actually with your wife doing PhD weight loss. That has made me feel a lot better. It's helped my sleep and all of that. But I can tell you that it's difficult. And I can only imagine that these symptoms get worse. And it's something that I've been looking at exploring. I have polycystic ovarian syndrome. So I've struggled with issues throughout my whole life. But I also know when doctors have put me on synthetic estrogen in the past, I don't feel that great. So what would you suggest for people who are starting down the path to menopause in that kind of 35 to 50-year-old range?
Yeah, so it's funny. I was actually just in this kind of heated debate on Instagram where there was a doctor, I won't mention his name, but he was saying for women who are perimenopausal, hormone replacement shouldn't be considered until all lifestyle is dialed in. And he's just getting trashed by all the women in perimenopause who are frustrated with their symptoms. And rightfully so, because it's easy to say that as a provider, to say, oh, well, you need to dial in your lifestyle. Because like you said, as you were going through the PhD journey, you felt better, right?
I do. But I'm not at the end goal yet, but I still want to continue to feel better. I don't feel like I should be punished just because I'm still working in that direction.
And this is where a complete lifestyle approach could be supplemented with hormones if it makes sense. But this is a really challenging area because you are still making hormones naturally, right? So you are still making estrogen, progesterone, testosterone. So then how do we supplement that? And we would have to look at that based off of your symptoms, based off of lab values, probably multiple time periods throughout the month to know what's happening at what point in time. So it is possible to supplement with hormones during the perimenopause timeframe, particularly progesterone, maybe testosterone, usually not as much estrogen. But it's a difficult balance for sure.
So when somebody comes to you and says, what's the age where we should start looking at HRT? Are you the guy that typically recommends perimenopause, or do you believe that this should be something when you fully are in full-blown menopause, or do you think HRT should just be used sparingly?
Definitely not sparingly. There's, I'll kind of answer that backwards. So if you look at the recent literature from the Menopause Society, they published a statistic, I think it was late last year, that said that there were, of the women over the age of 50 who are candidates for HRT, 4% were on HRT. That is such a staggeringly low number of women who could be benefiting from HRT. Now, I'm not going to say it's for everybody, but definitely for more than 4%. So I think we're grossly underutilizing HRT for women. There's definitely a role, especially for postmenopausal women. But I think, when is it time to start testing? I start testing, early before perimenopause, because hormone dysfunction, hormone imbalance is a leading cause of bone loss, which is one of my biggest areas of interest. So if even a 25-year-old woman has dysfunctional cycles, we can measure, we can identify that. And then I'm going to want to take a closer look at her bone and see what her starting point is and how much bone she's losing. So I think we should be testing throughout the adult lifespan with both bone health and hormone health, and not necessarily treating, but at least identifying what the issue is. And then, is there a fixable lifestyle thing? Is there another pathway we could go? And then if not, then yeah, we can start supplementing with hormones.
You know, it's been so frustrating. And I think all the women out there who are listening to this podcast will probably in some way shake their head and go, oh, yeah. But I mean, I have always gone to the doctor. I have gone regularly. It took forever to get a diagnosis on polycystic ovarian syndrome. The doctors didn't even want to entertain it. And I was presenting not all of the symptoms. Thankfully, I was never insulin resistant. There were some other things, but it took a long time for them to even give me a diagnosis, which helped me kind of wrap my head around what I needed to do to fix my diet, to fix all of these things that were really difficult. I still, to this day, knowing that, have never had, and other female issues that I've had along the way, never been given by my general practitioner or my gynecologist basically the offer of even doing a hormone check, other than the basic stuff that they check with your regular blood work. And then there's also this movement now with women in menopause saying, hey, we're not afraid to talk about it anymore. There has been a real fear, I think, in the medical industry, with doctors, with society, to even acknowledge that women have struggles and that we need to look at in ways to fix these things. I think it's just sort of passed over. Have you noticed that to be true, that women's health has really been kind of neglected, at least in the field of hormones and hormone imbalances?
I wrote an entire book about it called the 10 Reasons Why Your Hormones are Failing You, I think is what it's called. It's all about hormone therapy, but the whole first half of the book is about the fact that in medical research, women have been under, if even represented at all. When it comes to care, we've treated over the last several decades, we've treated women as we've progressed in Western medicine just as smaller framed men. And that is not the right way to treat women. They're different. Physiology is different. So absolutely. I mean, if you think of it that way, then it kind of makes sense how we treat women in the medical system, but it is mistreating women. It's misogyny by definition, and it absolutely has to change.
I think it is. And it really has become helpful to go online again and try to sort through some of the information. For women who are considering HRT or want to know if this is right for them, what are some good places to go? What are some good resources to look into to see if this is a real viable option for them?
Yeah, this is where, like, you were telling us your story of, doctors never want to talk about hormones. And that's true. And this is experienced by the majority of women who think that hormones might be an issue. That's why we have seen just a revolution of practices out there, telehealth practices, my own practices, that are just looking past that and saying, okay, look, let's test your hormones. Let's get you on an appropriate protocol. Maybe it's lifestyle. Maybe it's actually replacement. Depends on where you are. You have to go to somebody who's willing to have the conversation, because if their baseline is we don't test hormones because it doesn't tell me anything, then they're not going to help you in that department. I'm not saying they're bad doctors. It's just not how they're trained. It doesn't matter if they are endocrinologist, OBGYN, it's irrelevant. All doctors, with rare exception, have been trained the same way, which is we use hormones, especially for women. We use hormones as little as possible for as short a time as possible. And if possible, we just ignore it altogether. That's been the dogma for the last 20 plus years. And that all stems from the studies that came out in the early 2000s that changed the face of hormone, probably care forever. So you have to go to the right person. And that could be, if you're looking for books, like my book, the one I just mentioned, is a good way to look at it for postmenopausal women. Our resources are available if you follow the links that you guys will put out. Those resources are available. We talk about hormones specifically for bone health a lot. But there are going to be more and more companies that are coming out with good resources.
Okay, so let's shift gears because, as you mentioned, you are, and this isn't even shifting gears, it really leads, these things go hand in hand. Your hormones, getting them properly balanced, and osteoporosis, your bone health. This is a concern, again, for men and women. And I can remember as a kid being traumatized, seeing the lady who lived next door with the hump, the hunch over. Everybody always was like, what happened to her? This is a real problem. And the answer isn't just loading up on calcium anymore. There's real things that we can do to make sure that we are increasing our chances at keeping our bone density and our bone health, including exercise, physical fitness. What are some of the best things that we can do for bone health?
Yeah, good. This is again my area of such interest
This is
right
it.
now. This is it. This is almost all I talk about because it does tie together all of my interests in diet and exercise and
Mhm.
hormone therapy because it all comes down to bones. In fact, we have changed our language a little bit and we're trying to push this into the younger audience to say that we've learned so much about bone health, especially in our practice, that really we look at bone health now as a biomarker of health span, meaning that if we can measure bone quality and quantity in young adults and track it over time, if you're losing bone, something's wrong. So we need to reframe the way we think about bone health instead of just thinking about your elderly neighbor that clearly had osteoporosis and
Yeah.
vertebral fracture. We need to think of it as, okay, what's your starting point? When you are a 25-year-old or a 30-year-old woman or man, what is your starting point of bone density and quality? And if it's bad, it's going to change the way that you should be doing exercise, that you should be eating, that you should be very conscious of hormone health as you age because you have a bad starting point. And we need to know. And right now, we're not screening until way, way too late for both men and for women. So bone health has become my major mission and passion to educate the world that we need to screen early, look at it as a biomarker of health span because there are so many things that we can do.
I love that. And you're one of the only people that I've heard really talk about this. And I was searching through your podcast earlier today and I was blown away because I think we think of bone health when we need to, right? If we break something or we're not thinking of it as this marker. And when would you recommend people get that baseline scan? At what age should people be looking into
Yeah.
that?
I would love to see a recommendation to screen at 30 because we know peak
Hmm.
bone mass occurs somewhere early mid 20s. So if we screen everybody at 30, we're going to be on the backside of that. The question is screening with what? Because right now, screening is done with DEXA, which is an X ray like machine. And it's okay, but it only tells
Hmm.
us about density. It doesn't tell us about quality. There's a newer technology that is becoming more available that is, I hope to help to bring this out. But there's a way to use ultrasound to do this too. It tells you about both density and quality. That device is called a REMS or from the company Echolite. So that is not widely available. It's becoming more and more available. But that's what I would love to see in the future us do is to use an ultrasound, no radiation technology that can tell us both about density and quality, starting at 30 in both men and women.
You need the insurance companies to probably catch up with you because I'm guessing a lot of times they won't do these as preventative screenings, and so it can sometimes be a cost issue that people may hear this and go, "Wow, I really want to get this in my chart. I want to be able to track my bone density, my bone health." Is it ever possible that you can get this from your doctor, or typically do you have to go out of pocket to get these kinds of screenings?
The ultrasound device is not covered by insurance at this point.
Hmm.
The DEXA, your doctor would have to make an argument that you have pre-existing risk factors, and there's a pathway that they could go down. How frequently that would actually be approved, I don't know. I just look at it from our patient population. We're a cash pay practice anyway, so I just say, look, we can try to run this through insurance, but plan to pay for it in cash. Fortunately, a DEXA is going to be $100, $200. It's hopefully not going to break the bank for you. The REMS is just a little bit more expensive, usually $200 to $300.
Okay, so I wasn't kidding when I said calcium. My poor grandmother took calcium like it was going out of style
Yeah.
because she wanted to keep her bones healthy, obviously. One of the problems is when you start getting built up calcification, that can lead to strokes, which happened to her. When we hear about supplements, and that's not always true. When we hear about supplements, there's fish oil, there's herbs, there's vitamin D, there's all these different supplements that come into the conversation. I like to take a handful of them, and a doctor just recently told me I'm paying for really expensive urine. What's your take on supplements and what we should be taking for bone health and just for optimal health in general?
Yeah. I'm curious, was that doctor particularly healthy looking that told you that?
Very, very thin and wasting away because I went through all my supplements because I actually love to research this stuff. I love, especially now that I'm on this health journey, I've been really trying to take responsibility for everything that I'm putting inside of my body. And so I feel like I've come up with a pretty good routine of things. And so she was from Canada, so we can't judge. But no, she wasn't. She was very thin. I will tell you, she was very thin, but maybe not in the best of ways.
Yeah, I love hearing those comments from people who are just clearly unhealthy, and maybe that wasn't her. But yeah, so we're a big fan of supplementation, except that I don't think it is. I think it's overutilized, especially in the bone
Mhm.
health space. I kind of joke with my audience. I'll say, for a group of people that don't want to use bone health drugs, you guys sure like to use supplements.
Yeah.
And that always gets a laugh because they know it's true because they're always looking for like the magic bullet. They don't want to take a drug, but they want the supplement to fix their bones. And
Of
that's the
course.
wrong approach. We need to start lifestyle. So we have our pillars, which are exercise, nutrition, sleep, and stress management, right? So I think it's actually called mindset. But anyway, those 4 pillars. And if you don't do those 4 things well, the supplements aren't going to do you any good. So you are then just paying for expensive urine. But we know that it's difficult to get adequate nutrition even through the best food sources. We live in a toxic world. So things that can help with detox or reducing inflammation, reducing oxidative stress, all these things are likely going to have benefit. Our approach is to use biomarkers. We do a lot of blood tests. We look and see things that might be deficient, B12, folate, omega-3 index. These things are measurable. Red blood cell magnesium, these are measurable, right? So then we can make recommendations based off of blood work. It's a really nice way to do it because then you know if you have too much, too little. We can't test for everything, but we can test for a lot of things. So our approach is to work on lifestyle first. We add in supplements where it makes sense, but I've really pulled back over the years as far as how many we recommend because if I went through somebody's labs and genetics and their history, I could come up with a list of 50 different products that I could recommend that they take. Nobody's going to take that many supplements. So we need to find what is the right balance? Is it 4 or 5 things to add to your regimen? Great. Let's do those 4 or 5 things. And probably we should be rotating them. I want to mention calcium too. So the current recommendations from the Osteoporosis Foundation is to take 1,200 milligrams of calcium for postmenopausal women and 400 IU of vitamin D. This is archaic recommendations. Osteoporosis is not a calcium deficiency problem. We don't develop osteoporosis because we don't consume enough calcium for the vast majority of people. It's a bone metabolism problem. If we want to build bone, we do need some calcium, but most people can get it through diet, especially if they're consuming dairy. But we do need minerals. And so our approach is usually to use some form of calcium. We don't necessarily use very much. We use whole food forms of it, and then we combine it with other minerals. So it's really a multi-mineral approach. You need the magnesium, you need the potassium.
And for absorption too, right?
Yeah,
right.
That's right. They get absorbed together. They get utilized together. And if you just mainline 1,200 milligrams of calcium, it's not going to be well absorbed. And it is going to result in a spike of serum calcium in your blood, which is dangerous. As you mentioned, she had a stroke. We know that heart attack and stroke is associated with calcium alone if you're not taking it with vitamin D. So yeah, it is a real concern that I have that we've been told that for decades. I mean, I told my patients that when I was practicing orthopedics. We just, as those of us in the conventional medical model, we don't really understand supplements. So until somebody starts to actually learn about the research behind it and look at the physiology of bone health, they're going to continue down this pathway of those general recommendations, which are not serving many people.
All right, guys, you heard us talking to Dr. Doug Lucas today. Well, Dr. Ashley Lucas is the founder of PhD Weight Loss and Dr. Doug's wife. And let me tell you guys, she has made it her life's mission to make sure you have the keys to a lifelong weight loss strategy. Dr. Ashley has talked very candidly about her struggles with her weight and her health throughout her life as a dancer. And she put all of her experience to work as a nutritionist to create a program that is scientifically based. And I've been using PhD Weight Loss now for the last several months. Katie Gorka has used it as well. She was on the PhD plan about a year ago. She has been in maintenance after losing 35 pounds. Dr. Sebastian Gorka, I think he lost 45 pounds and he's kept it off. And I just lost 3 pounds last week. So how about that? This weight loss is fast, but it is real. It is something that actually, you're not hungry. You are constantly eating small meals. And this is a program that's really individual for each of you. So when you call PhD Weight Loss, you're going to meet with a counselor who takes into consideration your life, your challenges, what your health journey has been like. And they create a plan that is comprised of high protein, whole foods, and fats that work to help you lose weight and keep it off without the hunger, without the medications, without the shots, real lasting weight loss success. Now, if you want to try the plan, we have an incredible offer for you today. The first 11 callers who mentioned Jen, that's my name, get 2 free weeks added to their program. Plus, when you fully commit, you'll receive 15% off your entire program. Guys, this is incredible. Plus, get a free weight loss and energy supplement. That's That's fantastic. And your program will be backed by their Get Results Guarantee. That's important. Just mention the word Jen when you call. So mention the code word Jen, and you will get all of those money saving offers at 864 644 1900, 864 644 1900. You can also check out the program online, myphdweightloss.com. I know Katie needed a whole new wardrobe. My clothes have been fitting a whole lot looser. I've been getting some new clothes on the way as well. We want you to have those wins, better fitting clothes, better results when you go to the doctor. You'll see that scale move and you'll have more energy. That's the real benefit. You'll have more energy to spend running after your family or keeping up with life. And there is nothing better than feeling better. So call PhD Weight Loss today. Again, use code JEN to get that money saving offer. The first 11 callers are going to get a great deal. 864 644 1900. 864 644 1900. Code word Jen. 864 644 1900. And you can always check it out online as well. MyPhDweightloss.com. You will love the success stories. MyPhDweightloss.com. Use code Jen. 864 644 1900. Yeah. All right. What about peptides? Because I've heard a lot about peptides lately, and that seems to be the new thing. I haven't tried them yet myself, but I've seen a lot of compelling stuff about different things, including bone health that can help with weight loss. I mean, there's all kinds of peptides to help with all different things. I even saw one that scared me that can give you a tan, which,
Nice.
sometimes
Melanotan.
a little pasty me would like that, but I don't. So what do you
Yeah.
think about peptides, Dr. Doug?
I think peptides are a really cool space. It's a challenging space because the evidence isn't great. So we use them in our practice, but we're only using peptides that have really compelling human data to support it. Some of these peptides are actually drugs that were explored for FDA approval and then didn't get approved for one reason or another. So they actually do have good evidence behind them. But most peptides have pretty limited evidence. Some people are even using peptides that have no human data to support it. So it's kind of a murky space. So if you're getting into the peptide space, be careful, go to a doctor that knows what they're doing. But you mentioned some of the things that are really important, right? So the tanning one, that's melanotan, and it's an interesting peptide. The question is do you want to tell your melanocytes, those things that can become melanomas, to work overtime? I don't know.
Pass.
I've used it. I
Really?
actually, my tan looks great on melanotan. It's really interesting. So I think it's interesting. The weight loss ones, I mean, the GLP-1 craze, of course, is out there from a drug perspective, but actually semaglutide and tirzepatide, the generics of the brands, those are peptides. So tirzepatide
Does that
is
hurt bone health, by the way, the GLP-1s? That
Yeah,
was another
interesting.
question. I've heard a lot about that.
Interesting. So the answer is if you look at populations of patients taking these, yes, absolutely. And I can tell you clinically, for patients that have come in that have been on them and wanted to stay on them because they're on a weight loss journey, they have continued to lose bone despite all the other things that we're doing. So I think that we are going to see an epidemic of osteoporosis and low bone density for people that are using GLP-1s. And I don't know if it's the physiology of the drug or if it's just the fact that they can't consume enough protein, because that's real.
Yeah.
So I don't know what it is, but I am very worried about that. Yes, when it comes to that, I'll mention one other thing about peptides too. Remember that peptides, a peptide is just a short protein. So you'll see the word peptide like collagen peptides or over the counter.
Yes.
You see peptides in skincare products, right? So a peptide is just a short protein. It can be a very powerful one, like for example, insulin, which if you were to take too much insulin or not have insulin, it would kill you. That's also a peptide. So we need to kind of maybe take a step back and just be what is the thing that we're talking about? Tirzepatide, GLP-1s, those are peptides. Over the counter collagen peptides, obviously those are very benign. There are some that are very dangerous. So you just really have to use them appropriately and know that they are not FDA regulated. They are not pharmaceuticals. So the provider who's recommending them really has to know what they're doing.
Very good advice. All right. I'm telling you, we talked for like an hour, but I have a couple more questions for you if you have the time. Diet. Obviously, you just brought up protein. That seems to be the latest thing. I just read a story actually that of people's grocery consumption now, people are really prioritizing protein finally. That's truly just to tell you about my journey. When I gave up refined carbs and when I gave up processed foods, that's when I finally saw the scale move because I got to tell you, that was a struggle for me with my polycystic and carbs and I do not get along. And I'm not talking about the good carbs. I'm talking about the nasty stuff, but they slip it into into everything. And doing vegetables, fruit, a little bit of fruit, not really much anymore, maybe a little bit of berry during the day, but just vegetables and meat has really helped, eggs as well. What's the diet? I know some people say you can overdo protein, bad for your kidneys. What do you think is the optimal diet? Because there's so many out there.
Yeah, great question. So I think if you were to like plug what is the most powerful tool, it's going to be diet, hands down, no question. And I look at diet like this, and you've obviously talked to my wife, Dr. Ashley
Hmm.
Lucas. I mean, we look at this similarly. I take even a kind of a little bit of a different approach in some ways, but I look at food as fuel. We need the protein. I can tell you, I've looked at the kidney side of eating too much protein extensively. Nobody, unless you have bad chronic kidney disease, nobody's going to overeat protein.
Okay.
It's not physically possible. We have safety data up to 300 grams. Like you're not going
Wow.
to eat 300 grams of protein a day. So we don't need to worry about the kidney side. A lot of people in the bone health space will worry about like the acid load, the quote unquote acid load. That's all nonsense and garbage as well. I've done video after video on that topic. Protein has been misrepresented because it's challenging to talk about without talking about things like the environment and
Hmm.
animal husbandry and agriculture and ethics and morals, and like, so people just don't talk about it, right? So over the last several decades we've just heard the conversation of carbohydrates and fat, but
Yeah.
nobody's talking about protein until the last few years. So when I talk about diet, I say, look, we need to eat a protein forward diet, and my preference, preferably from animal sources, because it's better absorbed. You're going to have better results. It's going to be less inflammatory, less carbohydrates. If you don't want to use animal sources, you can do that too. You just have to do it correctly, but you have to get adequate protein. For my patients that are looking to improve muscle and bone, we aim for around 1 gram per pound of ideal body weight. For those that are on a weight loss journey, we back that down a little bit because at 1 gram, you're going to probably stop losing weight.
Hmm.
But 1 gram is our starting point for most of our patients. And so for most people with osteoporosis, they're 120 to 140 pounds. So that's how many grams of protein we're having them start with. Some people end up needing more, some people need less. The older you are, the more you need. And so once
Interesting.
you like kind of dial that in, then everything else is sort of gravy. Now, do I recommend processed food? No. I tell people to eat a whole food diet, not from the store Whole Foods, but a whole food diet that comes from as many single ingredient foods as you can. Like you, I mostly eat meat and then
Hmm.
some vegetables and a little bit of fruit, and that's it. I pretty much eat nothing that comes out of a box or a bag that has a wrapper on it. Like it's
Shop the
pretty much whole
perimeter.
food sources. Yeah.
Yep. You
You know,
shop
and
the
if you
perimeter of the grocery store. It really
yeah, if
helps.
you do that, so many people are not doing that. If you switch from a standard American diet and then you do that, you will see improvement across the board in just about everything that you can think of. So it is, again, it's the most important factor.
It's true. And I shared this with Dr. Ashley. As I've been doing this, I went to the doctor and my blood work wasn't bad. I mean, I've always been lucky enough to be pretty healthy, but everything was better than it was. I mean, every single thing after making that shift. And so it is something to consider. All right. So you mentioned the pillars of health. And I'm big into this because it's all about balance. You got to get the sleep, the stress management. That's the toughest part for me these days. But what are your wellness tips? If you could wrap up today with just what you recommend for people who want to live, as you say, live better and longer. What do you recommend? What are your must-haves and your takeaways for us today?
Yeah. I mean, I think if I just run through the pillars and I think, okay, what's the lowest hanging fruit for most people? It
Hmm.
would be the diet that we just talked about, protein forward from animal sources, whole foods. And then, if you want to like from there, if you want to talk about paleo, Mediterranean, keto, like we can talk about all those things, but it generally doesn't need to be that dramatic and drastic. We just need to eat whole food sources that's protein forward. Simple. From an exercise perspective, resistance training is king, both men and women. There's a role for cardio. It has benefits in some ways, but we need to do resistance training. I mean, almost all of us lead sedentary lifestyles. We have to stress our muscles, which is going to help stress our bones. We need to do probably 3 days a week of resistance training as heavy as you can with good form so that you don't get injured.
As
On
heavy as
top
you
of
can. Okay. Because a
as
lot of
heavy
people
as
will
you
say
can.
a lot of repetitions with lightweight. So as heavy as you can for at least 3 days a week. Okay.
Yeah, don't stress your joints like that. No, we need to go heavy because if you don't go
Mhm.
heavy, the limiting factor generally is your mindset, right? You just get bored. If I'm doing over 12 reps, I'm just bored. Like I'm stopping because I'm bored and I like sort of got confused, like we need to
Forgot where
be
you were.
lifting. I'm just like, what am I doing right now?
Yeah.
So we need to lift heavy, and we know that heavy lifting is going to be the thing that's going to help build muscle. It's going to help build bone. I'm not saying, doing 30 reps with lighter weight has no benefit. It does have benefit, but we need to lift heavy if we want to maintain our muscle mass, which is one of the most important things we can do. On top of that, if you have osteoporosis, learning how to do impact safely is really important, because we need impact to stimulate bone growth. You're not going to build muscle let me say that again. You're not going to build bone with just resistance training. We have to have some form of impact and the right diet as well. So those are probably the two biggest ones. Sleep, we know sleep is critical. How do we get good sleep? Well, especially for postmenopausal women, hormone replacement therapy is the biggest tool, hands down, no question, that you can use, because progesterone is going to have such a tremendous impact when used orally. So lifestyle, sleep, hygiene, all the things that people talk about, which we could go through, but having good sleep hygiene, consistency, managing stress, which is the next one, and then HRT for women as a really good starting point. From the mindset perspective, this is a toughie. And we've been working on how do we help people with the stress, with just all the things that come along with being humans in our world. How do we help people have the right mindset? And so we have group coaching. Sometimes we'll do one-on-one coaching. We have all these different tools that we're developing for people, because honestly, if you don't have the right mindset, none of it matters.
That's true.
None of the other tools matter. So mindset is a tough one. It does have to be in the right place, but it's hard to tell people where to go for that, because it's so vague and non-objective and challenging to treat.
I think as a woman, as a busy woman who's got a family to take care of and a couple of businesses to run and a radio show every day and the podcast, if I can carve out 15 minutes for myself to do something that's mine, whether that's taking a quick bath, maybe that's reading a book, if I can find 15 minutes a day, and we all can, it's kind of how I had to get myself into exercise. Find 15 minutes. There's something about that number that seems really accessible, even when you're super busy. So I don't know. That's just my tip: is find 15 minutes just to do something you want to do in a quiet space. It really does help you refresh, for sure. Well, Dr. Doug, you are so amazing. You and your wife are awesome. And thank you so much for the advice today. I know we would love to have you back on and talk again. I want you to get his podcast. Look for it, The Dr. Doug Show. Also check him out online, drdouglucas.com. That's where you can access the books available. I know all of the resources. And probably even if you're in the area, they can work with you, right, at your clinic as well.
Yeah, we're actually all telehealth. So you don't need to be in the area.
Telehealth.
It's all over the country. Yeah.
Well, then we can all sign up. drdouglucas.com. I love that. And don't forget, thank you so much, by the way, for being with us. drdouglucas.com is where you can find him. And don't forget to get Katie's book. It is called Next Gen Marxism. Just because she's not here doesn't mean you get a break. You get to hear that. And you can search her out on Facebook as well. Look for Catherine Gorka. You can find me on Facebook and Instagram at Jennifer Horn Radio, and on Truth and on X at Jennifer Horn. And of course, we appreciate those 5-star reviews and sharing Happy Women with your friends. You can do that at the SalemPodcastNetwork.com, SalemPodcastNetwork.com/Happy Women. And we appreciate each and every one of you. Thank you, Dr. Doug. Thank you all for joining us for another episode of the Happy Women Podcast.